I'm with Dr. William Marder, Senior Vice President, Analytic Consulting and Research Services, Thomson Reuters. Hello.
Good morning.
What are you discussing this year at the World Healthcare Congress Middle East?
We've been working with the Health Authority of Abu Dhabi for the last year, looking at the health insurance claims and aggregating them up to develop quality measures for each of the hospitals in Abu Dhabi. And we wanted to talk about the general lessons from that. That's a project that's underway and the results haven't been released yet. So it was an opportunity to come together with others in the region and talk about the use of healthcare information to improve the quality of care over time.
And when do you expect to release the results?
You know, that's for the health authority to determine. But I expect the process is ongoing now, and as in most processes for quality improvement, some of the sharing of information quietly behind the scenes is appropriate before anything goes public.
Why do you think an event like this is important?
Oh, the health systems around the world are all very complicated, and trying to get a comprehensive view of the care delivered to patients and integrate that information is a big job. But it's a job that I think is deserving of a lot of energy, and that has the potential to improve the quality of care.
Because it could save lives all over the world.
Yep.
What are some of the challenges your organization is facing in the healthcare industry?
I think the big challenge is when you look at the information that exists today, you understand that it has strengths and weaknesses. And the biggest challenge is to pay attention to the strengths of the data you have access to and use it effectively. At the same time, you're working to reduce the weaknesses of the data. And that's true in the United States, it's true here, it's true wherever you are. The vision of electronic medical records coming in the future, that's the future. We have patients today, let's try and do the best we can for them with what we have.
Do you think the innovations and the new ideas that are happening right now will help reduce the weaknesses in the data in the future?
Well, and I think the biggest thing that will reduce that will play to the strengths of the data and reduce the weaknesses are using the data. The kind of project we undertook to measure quality of care through a system, feed it back to the players in the system so they understand what their data indicate, and do it on an ongoing basis, so that, because often the first reaction to this kind of project is for the players to say, well, the data are flawed. And it's important to acknowledge that when you first start, the data are flawed. Let's talk about the flaws. Let's improve the underlying data while we're working on the care processes as well.
Did you hear about, or are you familiar with the hospital rating system for Abu Dhabi, the new initiative?
Yes, and we're very much supporting that.
Mm-hmm. And do you think it's going to help spread these kind of new initiatives in the region, or is it very hard, too big of a scale to?
Abu Dhabi is in a unique position today with the information infrastructure that you put in place over the last several years. But I think there are opportunities in Dubai and in other parts of the Gulf, and we look forward to working with health systems around the area, starting whatever the starting point is in the local environment and moving forward from there.
What are some of the innovations your organization brings to healthcare?
What we do is spend a lot of energy thinking about how to use readily available electronic data. We do it in the US, Canada, a variety of places around the world. And we've assembled a group of people who are expert in dealing with that and trying to incorporate new information as it comes in. The standard setting bodies around the world for quality measurement rely on us for interactive tools that help them focus on important quality metrics, given what's going on in the real world of patient care. That interaction with academic medicine around the world has been very good, interesting for us and them, and I think has generated some good stuff.
What do you hope to learn or teach at the conference?
Well, for me personally, there's the opportunity to learn a great deal about the state of the art in the UAE. And this is a good group of people that have been brought together with really, world-class talent, and it's a good learning environment.
Thank you, Dr. William. It was a pleasure speaking with you. We hope that you enjoy the rest of the conference.
Thank you very much.